It's 4:40 p.m. here in Seoul. I'm Devin Whiting at the Arirang News Center, and it's time for today's briefing from the South Korean health authorities. We should be getting updates on the latest trends and figures. It looks like they're starting now. Let's listen in.
And we also have Mr. Jang Hyun-seok present today. We will be hearing the sign language translation from Ms. Ko-won-mi. First, we will hear from Mr. Son Young-rae about the countermeasures against COVID-19. It is March 28th, Sunday, and I'll start the regular briefing for today. As of midnight of today, there were 462 newly confirmed cases, and there were 20 imported cases. Yesterday, one person passed away. We pay our respect to the deceased, and we pay our condolences to the family members. Yesterday, there were around 1,000 vaccinations that occurred, and until now, there has been 790,000 vaccinations. Started from March 21st to March 27th, there were some developments, and I'll update the numbers now. Over the past week, on a daily average, there were 422 newly confirmed cases. Compared to 416 from the previous week, it is at a similar level. Over the past week, reinfection level across the country was around 0.99, so it was close to 1.03 from the previous week. By regions, in the metropolitan area, there were 228 cases, and there were 134 for the non-metropolitan cases. Right now, in the metropolitan area, the numbers are still high at around 300, and in the non-metropolitan areas as well, the number has gone to become more than 100. In case of the trend of the infection, a lot of it is happening through small gatherings, such as family members. And we are also seeing cluster outbreak. We are seeing that the infection in foreign personnel are decreasing. However, we see an increase in infection in multi-use facilities, including areas such as the public baths, singing rooms, and in restaurants. When we look at the cluster outbreak cases, a lot of people with symptoms still visit the places where a lot of people are visiting, and sometimes people still go to work when they have symptoms as well. If you have fever or respiratory symptoms such as coughing, and if you feel unwell, please make sure to stay at home, and please make sure to stop from going to work or using multi-use facilities, and please visit nearby screening centers so that you can get tested. Starting from January to last week, there has been around 300 to 400 newly confirmed cases at a daily level, and it has been going on for 10 weeks, so the number has been stagnant. And we are seeing the outbreak in a lot of areas that we face in our daily lives. Therefore, it is important that we practice frequent personal hygiene and adhere to disease control at anywhere at any time. As of April, we will see more activities outside with spring coming in, and there are also religious activities that could happen, such as the Easter holiday. So therefore, we have to be especially careful in our daily lives. Now I will update you on the effect of vaccination. After vaccination, there are some immune symptoms that could arise. And in order to distinguish them, the government will look into it and make sure to analyze it. And a measure was developed as a result. Starting from the second week of February, there were vaccinations, and based on monitoring by CDC, 32% said that they felt uncomfortable after vaccination, and of those, around 2.7% actually visited a hospital. And we have gotten the reporting system, and the unusual feelings that were
수준이었습니다.
reported through these reporting system was 1.4% of everyone who was vaccinated.
접종자 5,400여 명을 조사한 결과로
We have done an
약
analysis for
75명,
around 5,000
전체의
people who have been
1.4%가
vaccinated,
이상
and we
반응으로
found that
하루 정도의
1.4%
휴가를
had
사용하였습니다.
to take a day off or
정리하면
more due
예방접종을
to
받는
unusual
3분의 1
symptoms.
정도가 불편감을 느끼고
A third of people
대략
who
1,
were
2%
vaccinated
정도는
felt uncomfortable,
의료기관을
and around
방문하거나
1 to 2% actually
정도의
visited a
이상 반응이
hospital
나타나는
or
것으로
had to take a day
분석됩니다.
off, and this was the amount
이러한
of
불편감은
the unusual
주로
symptoms
접종
that
부위의
arose after
통증,
vaccination.
근육통, 피로감,
Of these symptoms,
두통과
it
발열
included
등이었으며
the pain
접종 후
in the
10에서
vaccinated
12
area,
시간
fever,
이내에 증상이
and
나타나고
headache, and
대부분
these symptoms
48시간
came
이내
up within
완쾌되었습니다.
72 hours of vaccination,
연령별로는
and it
젊은
actually
층일수록
disappeared after 48
불편감을
hours.
호소하는
It was
비율이
also
높게
the
나타나고
case that
있습니다.
the people in the younger age
정부는
groups felt more
이러한 조사 결과를
uncomfortable.
토대로
Based
모든
on
접종
this result,
대상자에게 휴가를
to
부여할
all
필요성은
people
떨어진다고
who are
보고
being vaccinated,
이상 반응이
the
나타나는
government
경우
feels that not everyone
적극적으로
has to
휴가를
take a
부여하는
day
방안을
off. Therefore,
지지하기로 하였습니다.
the day offs will be
접종
given
후
to
이상
people
반응이
who
있는
actually
경우
get the
접종
unusual
다음 날
symptoms after
하루
being
정도의
vaccinated.
휴가를 적극적으로
So for
부여할
people who
계획입니다.
feel unwell
이상
after
반응이
being
지속되는
vaccinated, they can
경우에는
take a day
이틀까지도
off for
가능하며
one day.
이
And if
이상
this symptom
일상생활이 어렵다면
continues, then they can
의료기관
take 2
방문이
days
필요합니다.
off. And if it goes
이 휴가는
more than these
의사
2 days,
소견서나
then
별도의
people should be
증빙 자료를
visiting
필요로
hospitals
하지
to get
않고
medical care.
접종자가 신청하면
It doesn't have
적극적으로
to
부여할
have any
예정입니다.
evidential documents.
의료기관의
People
진단서나
can
확인서를 요구하는
actually
경우
tell
많은 접종자가
that they
의료기관으로
feel
몰릴
or
가능성을
they feel
우려하기
unwell or have
때문입니다.
unusual symptoms so that they can take a
이상
day
반응
off,
휴가는
because if there
가급적
has to be
별도의
evidential
유급휴가
documents, it would
또는
mean
병가
that there will
제도가
be
있는
crowding
경우
in hospitals and
병가로
other
처리하는
clinics.
것을 원칙으로 합니다.
Therefore, if there are unusual
참고로
symptoms
접종
that
당일에
arise after
접종에 필요한 시간에
vaccinations, then
대해서는
people can take a
공가나
leave.
유급휴가 등을 적용할 것을
And
권고합니다.
for vaccination, we
현재
actually
상반기의 경우
recommend you to
65세
take
이상
paid leave.
고령층과 함께 보건소 등의
So
1차
with
대응
people
요원,
in the 60s,
병원과 요양병원 등
the clinics
의료기관,
and long-term care facilities, other
사회복지시설과
medical
사회 필수적인
facilities,
인력 등에
and
대해
social
우선적으로
welfare
예방접종이
clinics
진행됩니다.
have continued with vaccinations,
하반기부터는
and these
65세
have been
이하
the
기저질환자를
priorities. The staff
중심으로
members were the
민간
priorities in
부문의
being
접종이
vaccinated.
본격화됩니다.
And soon we
이런
will be
일정에
starting
맞추어
vaccination
4월부터
for the
접종을 시작하는
civic
노인 장애인 등
lay people as
사회복지시설은
well. And
각
for
시설
the
여건에
senior
따라
facilities and the
병가 또는
long-term care
유급휴가 등을
facilities,
활용하도록 할 계획입니다.
the employees will be able
이미
to make
접종
use
중인
of the paid
요양병원
leave
등
as
의료기관에
necessary.
대해서는
And for the
병원협회,
medical
요양병원
institutions
협회
and
등과
long-term
적극
care
협의하여
facilities,
이상 반응 시 휴가나 병가 등의
discussions will be
사용을
carried out with the
적극적으로
association
보장할 예정입니다.
to make sure that a
4월부터
paid leave
접종을
is
시작하는
guaranteed when there are
보건교사나
unusual symptoms.
6월부터 시작되는
There would also be
경찰관,
the health
소방관 등의
teachers and
사회
police
필수 인력에
officers
대해서는
and the
경무 규정에
firefighting
따라
officers
병가를
who
적용할
would
것입니다.
be vaccinated as
상반기에
people
주로
necessary in our
집중된 공공 부분에
societies. We
인사혁
were
신청,
also recommending paid
행정안전부,
leaves as well.
기획재정부 등이
And
주관하여
the Ministry of
공공 부분의
Administration
세부 지침을
and
마련하고
Ministry of Planning and
각 부처와
Finance
지자체
will come
등에서
up with
소관기관과
detailed
단체
plans
등에서 이 지침이
so
준수되도록
that the
관리할
measures can be adhered to with
기업 등
the
민간
employees
부분에
in their
대해서도
institutions. Also for
고용노동부에서
private
사업장 대응 지침을
companies and
배포하고
private corporations,
지방고용노동관서에서 관내
measures
사업장을
will be applied,
적극적으로 지도할
and
예정입니다.
we're also going to provide some guidance.
산업통상자원부에서는
Ministry of
대한상의,
Industry
경총 등
and Trade
경제단체와
is
산하기관,
also working with
주요
other
업종별
financial
협단체들의
associations to
협조를
come up with
요청할
measures,
계획입니다.
and it is also going to request for cooperation.
중소벤처기업부에서도 지방
The
중기청과
SME
산하기관을 통해 중소기업과
Association is also
소상공인
coming up
관련
with guidelines
협단체들에게
for the
적극 안내하고
SMEs, and will be
동참을
providing
유도할
guidances to these SMEs and other
이와
small
함께
businesses.
국회에도 백신 휴가와
National
관련된
Assembly
감염병 예방법
is
개정안이
also
계류되어
looking
있는 만큼
into
국회에
the
적극적으로
measure for
협력하여
the
법적
vaccination
근거를
and
체계적으로
the
확립하는
paid leave
데에도
as well. And the
나서겠습니다.
National Assembly has actually
예방접종을
drafted
하고
a
근육통
bill
발열
that
등
is
이상 반응이
pending,
있는 경우
and we are
우선
going to be cooperating
타이레놀 등의
actively.
아세타미노펜 계열의 진통제를
So
복용해
when you
주시고
have unusual
증상이
symptoms,
심한 경우
please make sure
하루
to
정도
take
휴식을 취하면서
maybe
병가를
a
지켜보는
painkiller
것이
with the
중요합니다.
acetaminophen
이러한 휴가가
and make
원활하게
sure to
부여될
monitor
수
yourself
있도록
for a day
정부도
afterwards.
검정부적으로
The government
다각적인
will
노력을
also
기울이겠습니다.
make efforts so that
국민
people can take a leave
여러분들께서도
after
본인과
vaccination for
가족들
maybe a
주변의
day.
안전과 우리
The
사회의
citizens should also
지속한 일상
ensure
회복을 위하여
that
예방 접종을 적극적으로 받아주실 것을
we can come back to our normal lives, and we ask you to actively
오늘 중대본
participate in
회의는
vaccination so that this
중앙부처와
can be done.
대구시,
Today's
경상북도의
meeting was
여러
held together with
기초지방자치단체가
many
함께
local governments,
참여하였습니다.
such as the Gyeongsang-buk
지난해 많은
office as
코로나
well.
환자가 발생한 대구
Last year
동구는
in Daegu's
지속적인 방역
Donggu
소독과
area, there
드라이브스루
were
선별
a
진료소
lot
운영
of
등을
newly
통해
confirmed
방역에
cases,
최선을 다하고
and
있습니다.
it is doing its best of
올해
its
2월에도
efforts to
한 요양병원
adhere
종사자가
to the
감염이
disease control
확인되자
measures and to
확진 1시간
sterilize
만에
many
재원 환자 전원에
areas.
대한 선제 검사를
And
시행하는 등
even
재빠른 조치,
this year,
추가적인
it is
감염을
preemptively
성공적으로
responding
방지한 바
to any cluster outbreak to
경북
prevent further
포항시에서는
spread. In the
지난해
Pohang
12월부터
city of the Gyeongbuk
임시
province, starting
선별검사소
with
3개소를
December, there
설치하고
were 3
60여
temporary
명
screening
규모의
centers that were installed,
신속 기동 검체 채취팀을
and
운영하여
60
코로나19 검사를
people
선제적으로
actually
실시하고
carried
있습니다.
out the testing.
또한 지난 10월부터
And
각
starting in
보건소의
October,
역학조사를 위한 인력을
the
2배로
clinics
보강하여
has
역학조사
doubled
역량을
its staff
강화하고
members
지난
to increase its
1월부터는 지역
capability
내 발생
on
사례에
the
대한
epidemiology
심층 분석을
analysis.
전담하는 조직을
And there
신설하고
was also
대응
a
역량을 강화하고
different
있습니다.
task force team that was newly
식당,
established
카페, 종교시설
for
등
the empirical
많은 사람이
study.
이용하는 시설
In
약
areas
1만
such as
9천여 개소에
restaurants
대한
and
방역을
religious
강화하기
facilities
위해
where a lot of
생활
people are
방역단과
visiting,
방역
there
컨설팅
was
팀도
a
운영하고
consulting
있습니다.
team operated so that
경북
these could be
문경시는
monitored more
코로나19
strictly.
확산 위험이 있는
Munjeong City
관내
of Gyeongbuk
음식점,
Province
목욕장,
is
실내
monitoring
체육시설,
areas such
PC방
as
등
restaurants,
24개
PC
업종
cafes,
1,100여
and
곳에
the
대해
indoor sports
방지 장치를
facilities,
설치하고
and it
비말을
has
차단하는 칸막이
installed the
설치를 지원하는
sterilization
등의
and the
시설 개선
ventilation
사업을 진행하고
facilities.
있습니다. 문경시는 이를
Munjeong
위해
City,
관련
in
조례를
order to make
제정하고
this possible,
자체 예산
has come
57억
up with
원을
a separate
지원하여
department
방역
and
역량에
has
최선을
allocated
다하고
the budget
있습니다.
amounting to 5.7
정부는 다음
billion won.
일요일까지
Until next
기초지방자치단체가
Sunday,
참여하는
we're going
중대본
to hold
회의를 계속
meetings together
개최하면서
with these local
지역의
government
모범 사례와
offices so
아이디어를
that we
공유하여
can have
현장
lessons
중심으로
being learned
방역이
from the
강화되도록
best practices
노력하겠습니다.
of such offices. And we're also going to have some site visits.
포근한 봄날이 다가오고 있습니다.
Now, warm spring
나들이와 야외
weather
활동이
is
증가하고
approaching
있고
us. We are seeing
단기간에
more
걸친
people going
거리두기
outside,
피로감으로
and we
방역의
believe that a lot of
긴장감이
people are
완화되는
getting
모습도
tired due to
종종
the
보이고
lengthened
있습니다.
social distancing, and we do see
다가오는
some of these
4월은
measures
본격적인
being relaxed
봄철이면서
by those
부활절,
who feel
라마단 등
tired.
종교 행사도
And there would
예정되어
be
있어
also
자칫하면
religious
유행이 크게
events
번질
that
위험성이
would be
존재합니다.
happening in April, such as the
영국과
Easter
미국의
holiday,
변이 바이러스
and there
등
could be a
변이
risk
바이러스의
in
유행이
cluster outbreak due
증가하고
to
있는
this.
양상을 보이는
We are
것도
seeing the
심히
variant
우려스러운 부분입니다.
virus spreading in
이런
countries such as
시기일수록
England, and
일상
this is
속에서
also a risk to us
기본적인
as
방역
well.
수칙을
Therefore,
철저히
in
지켜주시는
such a
것이
situation,
중요합니다.
it is important for our
많은
citizens to
사람이
adhere
실내에서
to
밀집되어 있는
the
곳은
personal
피해
hygiene
주시고
practices.
마스크를
We
잘
ask you to
착용하고
refrain from
손을 잘
visiting
씻으면
crowded places,
감염
and we
가능성을
ask you
크게
to
줄일 수
always wear
있습니다.
face masks and to wash your hands
90cm 높이
frequently.
비말
By
차단
doing so, we
칸막이를
will be able to
설치하면
decrease the number
식당에서의
of
비말
newly
확산을
confirmed cases.
대부분 차단할 수 있습니다.
And if you are
의심 증상이
actually
있으면
preventing
즉시
these
검사를
measures,
받고
if you are
사람이 많이
actually
모이는
practicing
장소의
these
근무를
measures, we will
자제해
be
주시기
able
바랍니다.
to actually prevent a spread in
현재까지
restaurants as
알려진
well.
과학적 사실을 바탕으로
Until now, based on
기본적인 방역
scientific
수칙을 잘
research,
지키면
we
코로나19
saw that
바이러스의
if you can
확산을
practice
최소화할 수
frequent
있습니다.
hygiene and practice disease control measures, we will be
65세
able
이상
to minimize the
고령층에 대한
spread of
예방 접종이
COVID-19.
본격적으로
Starting
전개됩니다.
in April, we will have
조금만 더
vaccinations
힘을
for
내어
those who
생활
are
속의
more than
방역 관리를
75
철저히
years
하면서
old in earnest.
고위험군의 예방
We
접종을
ask you to
순조롭게
be a little more
달성한다면
careful,
보다
and
안전한
if we were to
일상생활의 영위가
cooperate and
가능해질 것입니다.
actually practice personal hygiene, we
국민
believe that
여러분의
we'll be able to
적극적인
curb
참여를
COVID-19 and its spread in our daily
정부도
lives.
국민 여러분께서
We ask you to
하루라도 빨리
cooperate once more, and we hope that our citizens will be able to resume their normal lives once again as soon as possible. Thank you.
네, 지금부터 질의응답 시간을 가지겠습니다. 배석자분들께서는 단상 위로 올라와 주시기 바랍니다.
And that'll conclude our coverage of this briefing. Thank you for watching. Arirang News will be back at 6 p.m. Korea time. Bye for now.
COVID-19 vaccination is the first step